Welcome back to Health Matters. We're talking about cosmetic and plastic and reconstructive surgery, and with me today is Dr. Alexander Guba, who is a plastic and reconstructive surgeon at Greater Baltimore Medical Center, and Dr. Mitchell Cantor, who is also a plastic and reconstructive surgeon at GVMC. Welcome. I think we went into the break saying, how do you find somebody who's qualified to do such intricate work as we have seen in those two stories? What would you advise?
That's an important question, Ann, and I think you want to be certain that your plastic surgeon has completed a fully accredited training program. There are a number of ways you can do this. You should check with your local hospital. They will tell you who is accredited to perform the type of surgery that you're interested in. The local medical society is a good source of information. And I think also you should feel comfortable with the plastic surgeon that you're seeing. You should feel that you're able to communicate with him or her and that they're listening to what you have to say.
I would think there's so many different ways of doing different procedures these days as well. Do you ask the surgeon, how are you going to do it? What materials are you going to use to do certain things? Dr. Guba?
I think patients are certainly much better qualified today to ask the appropriate questions than they were, say, even 5 years ago. The techniques they're well aware of, say, for augmentation, mammoplasty, the various techniques of putting an implant either underneath the breast itself or underneath the breast muscle. All of these things that patients have really come to appreciate and should, again, feel comfortable with their plastic surgeon and really make their decision in that fashion.
Well, it's interesting, you talked about breast augmentation. That's probably a good combination of cosmetic and reconstructive surgery, and you brought some props here. Maybe you could show some of the more commonly asked questions of patients who come into your office saying, what's going to happen to me and how does this all work?
Sure. Well, one of the devices we use is the breast implant. I've had lots of people ask me to show this to them, and I brought one here. This is a typical silicone gel-filled implant. There are several different types of implants in use now. This is one of the more common. It's very soft. It has the consistency of a normal breast.
And this just goes right into the breast area.
This goes for breast augmentation, enlarging the size of the breast. We're putting these now underneath the muscle, which is under the breast. We feel that there's a lower incidence of complications, that it gives a nice, softer feel to the breast, and this is working out very well.
What kind of complications are we talking about, or possible complications or something?
The incidence of breast cancer remains pretty much unchanged for women whether they've had this operation or not. So it's very important that the women continue with mammography, as mammography is one of the means of finding a cancer actually before it becomes noted. Consequently, by putting these implants underneath the muscle, radiologists can follow and more closely get a mammogram that would reflect the good breast tissue as opposed to having the distortion of the implant.
No, that's important. They'd want to be able to detect any possible cancer if it should come back.
Sure.
Is this newer material now? I've heard studies that old ones had drooped or had become rigid. And
the body forms a normal scar around these implants, and that is absolutely normal. The body has to do that. But that scar can be made much more negligible if it is placed beneath the muscle. And with the newer implants, there's less bleed, meaning there's less of that tissue that gets out into the surrounding tissue. Which brings up another interesting topic, which is how to reconstruct breast after mastectomies for cancer. One of the techniques that's used is the use of an expansion device. Mitch, you may want to show the expander that we have.
This is a typical tissue expander. It's a balloon-like device which is placed beneath the surface of the area of the mastectomy, usually underneath the muscle also. And then this is expanded every week in the doctor's office through this access port, which is also under the skin.
It's filled up with saline solution, right?
Filled up with saline to the desired size. And then once there's an adequate amount of tissue to reconstruct a new breast, the tissue expander is then removed, and an implant very similar to this silicone gel implant is placed in its place.
That's great. Well, we have other little devices here, and we'll probably talk about other cosmetic procedures as well as reconstructive procedures when we come back. And we will also have some headlines from our Health News Wire, so stay with us. Welcome back to Health Matters. We're talking about reconstructive and cosmetic surgery with Dr. Alexander Guba and Dr. Mitchell Cantor. We're talking about breast reconstruction and a lot of different ways of doing it, and you were saying that you can use the parts that we were showing, the little implants, or you can use parts of your own body. Dr. Guba?
That's correct, Ann. Basically, we've illustrated the use of breast reconstruction using plastic materials. We can also use or perform a breast reconstruction using one's own body parts, and that is routinely using the lower portion of the abdominal wall and use that as the breast reconstruction. And then a third variety would be to use parts of the body for breast reconstruction as well as some of the plastic materials that we've used.
I've heard you can even do tummy tucks as well as
Absolutely.
reconstructing a breast.
Absolutely. A combination procedure can be done so that one ends up with a tummy tuck as well as that tissue to reconstruct the new breast.
And so how does it work? You were saying there are so many other types of procedures now and ways of doing it, but we saw a forehead being made and cheekbones and chins, and how is that done? I mean, do you actually take plastic material to do that?
In the face, yes, there are a number of ways that we can augment or improve the appearance of the face. Some people have an underdeveloped chin, and there are these little implants that can be placed in the chin to give the chin a better, more normal prominence.
And that's placed right under the chin, and will stay there.
This is placed next to the bone of the chin. It goes usually inside the mouth. There's no scars. It doesn't show. Similarly, the cheekbones in some people are underdeveloped, and there are also implants that can make the cheekbones more highlighted.
So that would be like something like you would place it right here?
Exactly, and again, it goes in through an incision inside the mouth. The scar does not show. It really works very well.
Are these materials getting safer, or how are we able to do this? It seems like more and more people are able to have this kind of surgery now.
I think the surgery certainly is safer. The anesthesia has become much more safe so that the risks to patients are going down, and I think the quality of the results are getting better. So that all in all, the medical profession, I believe, in this regard is going in the right direction.
And I think we can say a lot of this is done in the office or as outpatient surgery. And there have been a number of advances in recent years that I think have made all of this safer. Of course, a good medical evaluation prior to surgery is important to be sure there's no underlying medical problems. But also some of the monitoring devices that we use now, I think, make this surgery safer. There's what's called a pulse oximeter, which is a little device that's placed on the fingertip, and it monitors the amount of oxygen in the blood at all times.
During the procedure, throughout the procedure?
During the procedure. In addition, we use an automatic blood pressure cuff, which is in place at all times during the operation, and there's a continuous readout of the blood pressure. And of course, we use a cardiac monitor, which virtually allows us to watch every heartbeat. We have newer and safer medications, which wear off quickly. They don't make people feel as sick as they used to in the past.
This must be a very pleasing job for you. You must see some dramatic results.
It's very rewarding. And we've found in many cases that when one part of the body is improved, that leads to an improved self-image, and patients' quality of life seemingly will get better. They'll lose weight, buy better clothes, etc. It's very helpful.
But screening for the right person, you can't look for miracles in something like this.
That's very important. If somebody comes in with really unrealistic expectations, that patient either has to understand that there are limitations to what we can do, or they're really not a candidate for the surgery.
I would think that is crucial and something that everybody should keep in mind. Well, thank you very much for being here today.
Thank you.
Thank you, Ann.